You're watching The Front Row. We are looking at the vaccine question in Kenya and the African continent at large. What are the challenges that are currently being encountered? Africa continues to lag behind in the access and availability and administration of the Covid-19 vaccines, even as governments rush against time to try and vaccinate their populations. What do we need to do as a continent? And we were at a point where we are looking at, even with the little that countries have been able to get under various programs, the issue of vaccine hesitancy still remains a big problem, as pointed out by Dr. Gitao. Dr. Ogwell, talk to us about this. As Africa's CDC, is this a point of concern? And how are we urging countries to deal with this?
Thank you. Vaccine hesitancy has always been a problem. From the period before COVID, during COVID, and I think it will still be a problem after COVID. We've done three things as Africa CDC. The first is the survey that Dr. Kwale had referred to. We've done a continental survey to assess the levels of vaccine hesitancy. And the results were really good. Only 1 out of 5 were hesitant. This was much better than we had expected, actually. We are doing another round. With this delay, we are also doing some rapid surveys now to try and assess if that has become worse or has become better, because some people have received the vaccines while there have been a bit of a delay here and there. So that is one thing we did with surveys. Second is we have a rumor tracking system across the continent. And using that system, we identify which rumors are going around, what type of misinformation is being shared, and working with countries, we develop proper messages to counter those rumors. The best, of course, is for countries to be more proactive and provide information to the public. And we are working with the risk communication and community engagement teams across the continent. The third thing that we are doing is we are encouraging countries that as soon as you receive your vaccines, get it out there. Vaccines should not be stored. The best vaccine is the one that is in someone's arm, because that is what is going to break the back of the pandemic. We won't stop spread unless people have those vaccines. So these are the three things that we are doing to try and address vaccine hesitancy, and we will continue to expand it as more and more vaccines come onto the continent. We are quite confident that this time the anti-vaxxers are not getting as much space as they used to in the days past. And this is because of the fine work that is being done by many governments across the continent with our support.
I want us to quickly take a look at some of the alternatives that have been there, perhaps Kenya, but this then brings us to the conversation of how we are financing vaccines. And it's a question I think I'll pose to all our panelists, but quickly let's take a look at that. 1 million doses of Johnson & Johnson vaccines have been ordered by the Kenyan government. Where we are now, 1 million doses of the Pfizer vaccine as well ordered by the Kenyan government. 75 million number of doses Africa was expecting through the COVAX from February to May, and 12 million, that's the number of doses Africa has received through COVAX in the same period. Well, looking at what we expected between February and May, 75 million, we have only been able to get 12 million as a continent. Dr. Ogwell, looking at how African governments are behaving and treating this, let's talk about financing the vaccine. Are we prioritizing it? How much would governments need? I know you wouldn't give me a figure, but perhaps it's a conversation that's ongoing at the Africa CDC. How do we budget to extensively vaccinate populations?
Let me start by saying that the loss is in the trillions of dollars if we don't address COVID-19 effectively using all the tools. Vaccines is one of them, but all the public health measures that governments have been issuing policy on are also part of the tools. If we don't do something, we're going to lose trillions of dollars. Our estimate today is that as Africa, we need to spend in the region of 10 to 15 billion dollars to be able to vaccinate 60% of the population. Now, there are three mechanisms to finance this up to $15 billion of vaccines required for the continent. And the first is the COVAX facility. And this is free, this is donations. But it is only the vaccine that is free. All the accessories have to be paid for, whether it is gloves, it is syringes, it is the time that health workers are going to take, disposal, etc. The second is the Africa CDC, Africa Union mechanism. And this one governments are actually paying for. It's not free. We negotiate the prices, but governments have to pay for them.
Right.
And the third are the bilateral donations that some governments have already received. How do you pay for it? This is something that governments have to prioritize so that our economies can go back to functioning properly again. There's no shortcut to it because we are not going to be able to get $15 billion as a grant from somewhere. Governments have to actually pay for about half of that amount because the other half we have secured from either COVAX or bilateral donations. But the other half, governments have to pay for it from their own local and domestic financing.
Dr. Gitau, are we investing enough in this as a continent?
I think the many things that COVID is, of course, teaching us as a continent in that we should have invested a bit more in research and development prior to that. But that said, we can't look back, but we need to look forward. One of the elements that some countries like Brazil and Mexico were able to capitalize on is the fact that they are able to run large clinical trials. Now, when we look at Africa as a whole, we may not have been able to run clinical trials, but we have had successful clinical trials for some vaccines such as malaria. And we have actually been at the forefront of running clinical trials for Ebola. So if we had negotiated appropriately on our small, it's not enough, the capacity is not enough to run, to do the big trials, but we do have some capacity to run clinical trials. So if we had used that capacity like Brazil and Mexico had done to negotiate with some of the companies to run some of the clinical trials, perhaps maybe that would have been one way of leveraging on what we have in terms of capacity here. So there's some small elements that we could have done a bit better, which we have not capitalized on, and mainly because we were shy and worried about clinical trials being run on the continent. Yet we do have the capacity. We've shown it during Ebola, and we've shown it even for malaria vaccines that have been tested on the continent. I mean, of course, the other thing that is a huge gap that other middle-income countries are actually capitalizing on is that they've invested in manufacturing. And because they've invested in manufacturing, they've had the ability to start and think about how to run this. The Serum Inc. in India that is getting the AstraZeneca vaccine done is something that was started and born in a country that at the time was still developing its manufacturing capacity. So what do we need to do as a continent? I think Dr. Ogwell will talk about production and manufacturing greatly, but we do need to actually accelerate that because one thing we have to realize with the COVID vaccines, even if we get them today, next year we'll need new vaccines. In a couple of years, we'll need to have to keep getting new vaccines. And if we continue relying on others to produce the vaccines that we'll need for COVID, we're actually not going to make inroads into the immunity that we need to protect ourselves and to come back to normalcy. So we have to very quickly and rapidly shift our thinking and invest. And it is one of those investments we say, okay, we don't have the money, but public health security has been shown now. COVID has shown us that without it, we cannot actually grow as an economy across the board on the continent. So we do need to actually accelerate the manufacturing process and then work with the big pharmaceuticals to actually see how we can get some of those patents off and start manufacturing locally. But a lot of things need to be put in place. Dr. Ogwell, of course, can speak to that because I think Africa CDC are definitely putting a lot in place to lay it on the ground. But yes, we can bring vaccines today, but next year we're going to need a new version because the variants will keep coming. Right. Because you mentioned 2%, 2%. So we're going to be at 6% in Kenya to get all the vaccines we've been promised. If we get them, that is, we'll be at 6% by the end of the year. That means we're not going to have enough protection to stop new variants coming into the country. So that's a big, big issue. And that's why we need to actually think about the future of manufacturing in terms of vaccines.
And you raise a very good point. We're getting into that. How can Africa stop being over-reliant on the West when it comes to this? Dr. Hwale, you wanted to say something on that?
Two things. The first one is actually a correction. The good news is that the government of Kenya has really invested in the procurement of vaccines. This financial year, they have availed 7 billion shillings, and we are projecting a 9 billion budget for next financial year. And just to state that the number of doses that we have ordered from the Africa CDC through the African Union is 10 million doses. Really, or just to clarify, we have booked 30 million doses of Johnson & Johnson, because that is what will take us to 60% of our population, 60% of 50. But immediately, we have committed and actually finalized the agreement.
Right.
I'm hoping that it will be submitted to Africa CDC tomorrow, where we now hope to get 10 million doses. As Dr. Ogwela said, hopefully in July. For us, we need it like yesterday, so hope we can get some in June. And that is what will now really drive our vaccination drive. So the government has invested. Coming to local manufacturing, there is good news. If Kenyans followed yesterday, the Cabinet Secretary, Senator Mutahi Kagwe, met the Human Vaccine Manufacturing Committee that has been working on a design of what we are going to do. Yesterday, we identified a site not very far from this studio here in Embakasi, where we have the new KEMSA warehouse. And there's this team that we've now developed, and we are seeking partnership to start a fill and finish. I can assure you we send expression of interest, and there are very many manufacturers who want to talk to us. So that is the step we are going. But also to just state that our plan is to go to fully fledged human vaccine manufacturing. We have timelines for this, and we are looking beyond the COVID vaccines. We are looking especially at vaccines that don't have any patent, the polio, the tetanus, the rotavirus, and hepatitis. So for us, we actually are moving. We are not just on the discussion point. I can assure you, we have even identified the facility where we will want to start the manufacturing.
Is just a Kenya initiative, or are we collaborating with other bodies? Maybe clarify that.
What we've started is first to be a Kenyan initiative before we bring in any collaborators. Okay. So we will be seeking collaborators, and our priority will be those already in the vaccine manufacturing field.
Collaborations into mass production and manufacturing of vaccines, as we're talking about here right now, and I'm already seeing a lot of questions around that. Many people asking that, when will Africa be self-reliant? Salim Hasios here says, governments must accelerate the desire for local production of the vaccines. Huge financial investments in local vaccine production must be prioritized. And I saw another one here that I would like Dr. Ogwel to talk about. Vaccine nationalism and vaccine equity are also important considerations in this discussion. How are they affecting our targets towards herd immunity? That's a question from Nasho Nadero, and I'd like us to pick that conversation from there. First, with you, Dr. Ogwel, before we take a look at what Dr. Tedros said the other day on the issue of vaccine inequity.
Thank you. You know, the tragedy is that Africa consumes 25% of the global vaccines, and we manufacture only 1% of what we need. We import 99%. It's an unacceptable situation, and it has to change. So when vaccine nationalism kicks in, and any country that is producing vaccines decides they are not going to export any. Africa remains a sitting duck. We are completely at the mercy of those who produce vaccines, and this should not be the situation. We are working to remedy that. In April, we had a big conference, over 40,000 people attended online and we formed the partnership to accelerate vaccine manufacturing on the continent. And there are three things that we are doing there. One is we've already identified 5 facilities that can be able to start manufacturing vaccines today if the licenses were to be made available. Second is we are working with different countries, Kenya included, to bring up any small capacity there may be or any commitment in terms of government commitment to start manufacturing. We want to bring that up. And finally is we are engaging in conversation with all those who are holding patents to COVID-19 vaccines so that we can be able to get licensing for manufacturing to happen on the continent. If we can be able to get that through soon, then the issue of supply chain being disrupted will no longer be a big pinch the way it is today. We must manufacture our own vaccines and other health products on this continent. If we don't do that, then we have no business really running the public health sector on the continent.
How soon are we talking? I mean, this continues to be a mutating situation, very fluid, very dynamic. How soon are we talking? Do we have timelines within which we hope this can be achieved?
But yes, Akisa, there are only 2 barriers. The first barrier is licensing, and I'm talking COVID-19 vaccines here. That's the first barrier. If we get the licensing, the intellectual property to be waived, we can be able to start manufacturing tomorrow. Because as you know, the Aspen factory in South Africa is already doing that. And we have 4 others that are ready to be able to start manufacturing if the licenses were to be made available tomorrow. The second barrier is expanding the manufacturing capacity, and that requires investment. There are partners globally who are willing to invest in smaller manufacturing facilities or to repurpose some of the facilities to be able to start manufacturing or to actually put in place new facilities. That will take a little longer. We are talking about maybe 6 months or thereabout to repurpose existing facilities. But we have at least 5 facilities on the continent that can be able to start manufacturing tomorrow. The only barrier is the licenses. Those who are holding intellectual property have not yet released those licenses, and we are working on that.
I want us to quickly take a look at what the Director General of the WHO, that's the World Health Organization, Dr. Tedros Adhanom, said yesterday with regards to vaccine inequity. It's an issue that continues to concern a number of world leaders. So let's take a look at that before we engage Dr. Gitao here.
18 months into the defining health crisis of our age, the world remains in a very dangerous situation. As of today, more cases have been reported so far this year than in the whole of 2020. On current trends, the number of deaths will overtake last year's total within the next 3 weeks. The ongoing vaccine crisis is a scandalous inequity that's perpetuating the pandemic. More than 75% of all vaccines have been administered in just 10 countries. There is no diplomatic way to say it. A small group of countries that make and buy the majority of the world's vaccines control the fate of the rest of the world. I'm calling on member states to support a massive push to vaccinate at least 10% of the population of every country by September, and a drive to December to achieve our goal of vaccinating at least 30% by the end of the year.
All right, Dr. Tedros there really not mincing his words, saying this is one of the biggest scandals we've witnessed. 75% of the vaccine globally, manufactured globally, have been administered to just 10 countries. This is an inequity that hasn't been seen before as far as this conversation is ongoing. Dr. Gitau, you started by saying that perhaps even as a continent, we are paying at a point where we did not invest much in research and development. How then can we reverse this at this point?
I mean, it's one of those conundrums we keep asking ourselves: what is the health priority, or what is the priority for governments in terms of the people? So I'll start by saying that without public health security, we definitely cannot actually become an economically viable continent. And COVID has shown us that. The lockdowns in Kenya, for example, have cost us numerous in terms of health, in terms of economic development, and has brought us back to a place where we were probably 20 years ago in moving forward in our economy. So we need to actually start by thinking about how we engage some of these partners. And I'm first going to talk about the vaccine diplomacy that Dr. Chedros talked about, to mention that we keep working on bilaterals, we keep being recipients for vaccines. The immediate is, of course, to fix that by ensuring that some of our partners are working with us towards trying to achieve some of the things we can't achieve in the next 6 months. We know some of our partners who have signed up to the COVAX signatories, and I won't mention particular countries, but we know them, and I think Dr. Tedros was very clear in saying they signed up to COVAX, and then they went and made their own deals with pharmaceutical companies. So their goodwill in terms of the COVAX is actually questionable, because they are undermining the amount of doses that COVAX can actually access, because if they're buying on the side as well as contributing to COVAX, that's an issue. Of course, everyone will then talk and say, every political leader needs to protect their own population.
Right.
And that's fine. We agree that that's okay. And it's probably the right thing to do. If our own president was not prioritizing it, we would question it over others, right? But then if you are getting more than you need, and there are some countries that have done that, in terms of vaccine diplomacy, we have erred, and we have actually brought about inequities that we've never seen before, because of our fear has actually built that nationalism. That said, as Dr. Well mentioned, production is the only answer we have to becoming less reliant and less dependent on some of the countries. So we've said we need to transform local production of the pharmaceuticals, and this should be a government priority. And it's great to hear that Kenya is making steps towards that. But there are a few things that I want to push and really advocate for. There are things that we need to do better in terms of financial leveraging of what we have to support localization of production. Energy is going to be a continuous issue for manufacturing. So if that is not being addressed in terms of the cost of energy, production is not really going to happen as it should. And then the other thing that we actually need to look at, we were told today that the government in the next financial year has committed 9 billion Kenya shillings. We also had that when we get vaccines, there's so many other things, just the vaccine itself. But when we talk about the needles, the human resources, etc., is that 9 billion shillings actually going to get us to where we need? I'm not an economist, but I think an economist may actually model that and say it is not enough. So we do need to actually look at our resources that we're putting in this space and push it. But that said, we have done so many things in building capacity for research and development. Every day, I think I've been seeing in the media African researchers globally who are being recognized in this fight against COVID, because they've been part of the vaccine development, they've been part of the diagnostics development, they've been part of research and development globally, but they can't work on the continent because physical resources have not been put in place.
Right.
And then many of us shy away from advocating for this. Let's call a spade a spade. What is being done is not enough. It's a drop in the bucket, and it's not going to get us to where we need to get in terms of production. And on top of that, the policies that are there right now do not support GMP, good manufacturing practices. And we saw it even in the PPE, in how we're producing PPE on the continent. We are now, if you're buying a Kenyan mask versus a Chinese mask versus a European mask, the quality, the issue of quality is a big issue. And I want to hear policymakers talking about, we will have the regulatory framework to ensure that the vaccines being manufactured on the continent can be exported to other countries without issues of quality being raised. Thank you.
You want to say something? In under a minute before we go on a break.
Yeah. Let me, Akisa, thank you. Just to quickly mention something. Number one, in terms of manufacture of accessories for vaccination, Kenya is well ahead. You may have seen us visiting a factory in Kilifi 2 or 3 weeks ago, the Revito Health. It is actually a major supplier of syringes and needles to UNICEF and to Gavi. So as a country, we went there because we wanted to be sure as the vaccines come, we are prepared.
Okay.
The other thing is to quickly mention that Kenya is already exporting veterinary vaccines outside this continent. In fact, on the committee that I sit, the veterinarians are sitting there and giving us their experience. So Kenya is a leader. In fact, we export the camel vaccines to Morocco, as we say, as we speak. And then the other thing I really needed to mention that we've been engaging the manufacturers. The 16 billion, first is a very good starting point because one has to be structured in how you bring the vaccines in, but we also have information the prices of vaccines are likely to come down. So we'll procure even maybe more than
we are banking on that. We are banking on the prices coming down.
It's because we've been discussing with them and we already have information.
Okay.
Yes.
All right. I want us to take a quick break. A lot of questions coming in. When we get back, I'll be taking a look at a number of the questions. We are told by experts that Kenya might be heading into a fourth wave. Are we prepared? Should we be worried? How about the various variants that are coming in? UK variant, SA variant, Indian variant, even with the vaccine. How do we put this conversation together? Do the vaccines respond to these various variants that are coming up? I'm seeing a lot of questions on that. We have the experts on this panel, so they'll be helping respond to some of these questions. Keep them coming in. This is The Front Row. We will be back with the last bit of the show. Stay with us.